Now we're talking about performances of two imaging tests. That's good, you see more disease. We kind of prove that PSMA is an efficient technique to show where the disease is with high sensitivity. Good. But at the end, we don't know if it really changed something. We don't know if patients will live longer with a better scan. We don't know if it really changed the success rate or the outcome of a therapy. So we wanted to find out. We choose the best indication for this imaging technique, which is detecting the recurrence after surgery. Currently, the standard of care for that is doing radiation therapy on the prostate bed, the prostate fossa. So the scenario is patient had prostate cancer, removed by surgery, and then few years later, 1 year, 5 years, 10 years, unfortunately, the PSA goes up again. You can test it in the blood. It means some prostate cancer cells are regrowing again. And you want, so far, with fair rate of success, those patients were treated with radiation therapy. So they got radiation therapy in the prostate fossa, the prostate bed, the area where was the prostate before. Because usually when the prostate cancer cell recur, it's in this area. In almost half of the case, it was curing still the patients of this relapse, of this recurrence. But it still fails in the other half. So here we have this now new PSMA scan that can show where the disease is. And we show in another study that in some cases, the relapse, the recurrence was not in this area. That would have, obviously, the radiation therapy would have failed in this patient because, in fact, the recurrence was in another place. So now we want to find out if it really changed the outcome in these radiation therapy patients. So randomized trial means patients are randomly assigned to one of the two groups. The first group is the standard of care treatment. Patient gets standard of care radiation therapy. And the other group is patient gets a PSMA PET CT scan before the radiation therapy. Then we follow the patient for 5 years, mainly based on the PSA, and we will see if at the end there is really a difference or not, if the patient who got the PSMA PET CT scan are doing better than the others. That's the main outcome. So far, we opened the trial in September 2018, so it's been about 6 months. We need 200 patients for statistical purposes, and now we are at 50, something like that. So I think it's a fair chance for patients to get a 50-50 chance of having a free scan, PSMA scan, in the US. Because so far in the US, PSMA scan is available only in the clinical research protocols in which patients need to pay around $3,000 for the scan out of pocket, not reimbursed by the insurances. So it's a fair chance to have a free scan there.